The new COVID variant Omicron has triggered a massive scare around the world as well as in India. Centre and states are on high alert in view of this highly transmissible variant. Centre has issued guidelines for international travellers from affected nations and made screening mandatory at all airports. Negative RT-PCR test before departure is a must now, and second RT-PCR test on arrival in India has also been made mandatory. After arrival, passengers would have to quarantine for 7 more days, after which they would be tested again. Sample testing would be done for travellers coming in from countries excluded from the flag nations. In all the cases, if any of the travellers test positive, genome sequencing would be conducted to ensure the COVID variant. Centre has also decided to review its flight resumption decision amidst the Omicron threat. Centre has also asked the states to enforce intensive containment surveillance measures. States have been asked to be on alert and prepare an action plan in case of any contingency.
India is ramping up COVID fight. Just as daily cases in India dip to less than 10,000 a day, a brand new threat stalks the world. Omicron, a new, more infectious COVID variant with possible vaccine-dodging capabilities. Amid looming threat, the centre issued an advisory to states on action plan. The letter from Health Secretary Rajesh Bhushan says states must monitor hotspots, putting international flyers from at-risk nations to screening and 14-day mandatory quarantine. Delhi Chief Minister Arvind Kejriwal wrote to Prime Minister Modi calling for a ban on flights from countries affected by the new variant.
दिल्ली के तमाम अस्पतालों और तमाम सार्वजनिक स्थलों पर कोविड प्रोटोकॉल को पूरी तरह से पालन करने का सख्त आदेश जो है वो दिया गया है। दिल्ली के राज्यपाल अनिल बैजल की तरफ से अहम बैठक की गई, जिसमें दिल्ली के मुख्य सचिव, पुलिस आयुक्त और तमाम वरिष्ठ अधिकारी भी शामिल हुए। और इसके साथ साथ ये फैसला लिया गया कि तमाम जो सार्वजनिक स्थल हैं और बाजार हैं, उनमें कोविड नियमों का सख्ती से पालन किया जाए।
In Maharashtra, the Municipal Corporation of Greater Mumbai announced mandatory testing for select international passengers and strict penalty for violators.
जो प्रवासी आ रहे उनको, जो दक्षिण अफ्रीका हो या दूसरे देश से आते कंट्री से, तो उनको जीनोम सीक्वेंसिंग का चेक करना पड़ेगा। उसके बाद जो हमारे देश में आते तो उनको क्वारंटाइन करके वो सब चेकिंग होने के बाद ही छोड़ा जाएगा।
After a brief scare over 2 people testing positive on arrival in Bengaluru, Karnataka has scaled up testing too.
All these tests we have sent to our labs, genomic sequencing labs. We are awaiting those results in another 5 to 6 days. Then I think we'll be able to tell you what kind of a strain is this. But we are definitely concerned with the new Omicron variant.
Chief Minister of Bihar and Madhya Pradesh too chaired meetings to discuss the threat of the new variant.
Madhya Pradesh Chief Minister Shivraj Singh Chauhan today called a meeting at CM residence on new COVID variant. Officers informed the Chief Minister that as of now, there is not a single case of COVID new Omicron variant in Madhya Pradesh, but as a precaution, state government has taken few decisions today in this meeting held by the Chief Minister Shivraj Singh Chauhan.
Will the new variant bring back fresh lockdown and derail the road to recovery? Bureau Report, India Today.
Let us walk you now through some news that you can use and take a look at what the states are doing to curb this Omicron variant. Let's start with Delhi first. There are strict COVID norms in place in public places. There's going to be a strict adherence to these. Hospitals to be prepared now for emergencies. You never know. The emergencies can happen and hospitals have to be prepared. The LG is going to be having a key COVID meeting today. As far as Maharashtra is concerned, international travellers are going to be following government restrictions. They are in place. Negative RT-PCR or full vaccination certificates are a must if you're travelling domestically. South African arrivals are going to be quarantined in Mumbai. So that is what Maharashtra has decided. Then genome sequencing for South African arrivals also. So the samples are going to be sent for genome sequencing. Passengers, as far as Karnataka is concerned, passengers from South Africa will be screened in Bengaluru. So, and samples are going to be sent for genome sequencing again as far as Karnataka. Now, Gujarat, there is a mandatory RT-PCR test that is going to be conducted at the airport. A testing is a must for passengers arriving from UK, Brazil, South Africa, China and Hong Kong. As far as Kerala is concerned, RT-PCR for international passengers is a must. In UP, RT-PCR test mandatory for international passengers. Screening and surveillance at the airports as well. Strict vigil on the foreigners coming in large numbers. As far as Haryana is concerned, COVID-19 restrictions extended till 31st of December. Deputy Commissioner has also asked to restrict the gatherings too, so in Haryana, and this is exactly what the states are up to. Milan Sharma, our health reporter, is now joining us live for the latest on this. Milan, there is also a revised guideline, if I'm not mistaken, that has been issued by the Centre for the International Passengers in light of the Omicron variant. If I'm not mistaken, that kicks in from 1st December. If you could just clear the air, because there's just a lot of confusion in terms of what these guidelines are.
Well, Chetty, the new international guidelines that need to be followed clearly state that any passenger traveling from the 12 at-risk countries, that includes European countries as well as United Kingdom, along with the African countries like South Africa, Botswana, Zimbabwe, Lesotho and other countries, they will need to first submit a negative test report at the time of boarding the flight from their respective countries. Then on arrival in India, they will again need to mandatorily go through an RT-PCR testing at the airport. Until such time that their test comes negative or positive, they have to wait at the airport. Once the test is negative, they will proceed out from the airport but will still need to self-isolate at least for 7 days, after which they will be tested again and another 7 days wait has to be done. So 14-day quarantine for them. If the samples test positive at arrival, that has happened in the case of 2 South African nationals who are tested positive in Bengaluru, they will be isolated and their samples will be submitted for genome sequencing. As per the new guidelines, 5% of all international travelers that are coming from each of these entry points at airports, their genome sequencing samples will be given to the state labs. This was decided in the meeting of the INSACOG because currently India, unlike other countries, is not restricting travels from the borders. The borders are not shut, but stringent and strict measures to test and genome sequence if the variant has been found in India is being done at the moment. And as you know, all the states have now mandated that an RT-PCR is necessary for those coming from at-risk countries. Certainly, it increases the inconvenience, but India is very vigilant at this point of time to check if the Omicron variant ever comes in the country and what isolation measures need to be taken there, Chetty.
All right, Milan, thanks so much for joining us with that clarity right there. A passenger who returned from South Africa to Dombivli in Thane district of Maharashtra recently tested positive for coronavirus. It is not confirmed whether the patient was carrying the Omicron variant of coronavirus, which was identified as a variant of concern by the World Health Organization. His samples are going to be sent for genome sequencing to confirm whether or not he's Omicron positive. A list of 466 people who arrived at Mumbai airport between 12th and 26th of November. These people arrived from Omicron-affected nations. Out of the 466 travelers, 97 were from Mumbai. The BMC contacted all the 97 so far via phone as well as physical visits by the BMC staff. The WHO has made fresh clarification on Omicron variant. The top health body has said that it is not clear if the Omicron variant is more transmissible or causes more severity in diseases compared to diseases to the other variant of COVID. The WHO stated that currently there is no information available to suggest the symptoms of Omicron are different from other variants of COVID-19. It further said that it may take days or several weeks to analyze the symptoms of Omicron. Preliminary information further suggests that the Omicron variant may have increased risk of reinfection and that the current RT-PCR tests help detect Omicron. On Friday, WHO classified Omicron as a variant of concern. It has urged countries to enhance surveillance against the variant. However, further studies are currently underway to determine if available vaccines are effective against Omicron. The Omicron threat has taken over the world now. Netherlands has now detected 13 cases of the variant, and countries worldwide are scrambling to contain the spread. Here's a look.
The new Omicron coronavirus variant kept spreading around the world on Sunday, with 13 cases found in the Netherlands and 2 each in Denmark and Australia. It came even as more countries tried to seal themselves off by imposing travel restrictions. The Dutch health minister said 13 cases of the variant were found among passengers who were on flights from South Africa that arrived in Amsterdam on Friday. Authorities had tested all of the more than 600 passengers on those 2 flights and had found 61 coronavirus cases, going on to test those for the new variant. First discovered in South Africa, the variant has now been detected in several countries around the world, from Germany to Australia to Israel. Last week, Omicron was dubbed a variant of concern by the World Health Organization. It sparked worries around the world that it could resist vaccinations and prolong the nearly 2-year COVID-19 pandemic. Omicron is potentially more contagious than previous variants, although experts don't know yet if it will cause more or less severe COVID-19 compared to other strains. However, the chair of the South African Medical Association, Angelique Coetzee, said in her experience its symptoms were mild.
There's no reason for panicking, as we don't see severely ill patients. It might change going forward. But the hype that's been created currently out there in the media and worldwide doesn't correlate with the clinical picture.
Countries have imposed a wave of travel bans or curbs on Southern Africa to try to stem the spread.
After the news of this variant Omicron, the world is now worried, and rightfully so. We all have many questions in mind about what this new variant is all about and how deadly is the new variant. Let's answer all your questions. There are certain frequently asked questions. The number one is, what is Omicron? Omicron is a new super mutant COVID variant. So that exactly is Omicron. Where was it first spotted? It was first detected in South Africa. The other question everyone is asking is, Omicron heavily mutated? The answer is, has an unusually high number of variants. The next question on everyone's mind is, does it cause more serious illness? Now, South African doctors report mild infections so far. So far so good. Will COVID treatment remain effective for the Omicron variant? The answer is, physicians are at the moment not too sure about this. The FAQ number 6, is Omicron more dangerous than the past variants? The answer is simple. WHO says virulence is not yet confirmed. They will take time to confirm the virulence. The other frequently asked question is, how transmissible is Omicron strain? More transmissible than Delta, but WHO still is not sure about this at the moment. Now, is the vaccine, most importantly, helpful in containing Omicron? We all have been vaccinated. Will that help us against Omicron? The answer is, vaccine remain key to reduce the severe diseases and deaths. Is Omicron more deadly? The studies at the moment are underway to assess just this. How can we stop Omicron from spreading? The fully vaccinate, wear a mask, exercise COVID protocols, maintain social distancing, go get your vaccination if you still haven't. Why is it called Omicron? The WHO skipped 2 Greek letters, NU and XI, which is XI, picked Omicron. And this is all that you need to know. These are the frequently asked questions and the answers to Omicron at the moment. Amidst the new threat of Omicron, the debate over the need of a booster dose has once again emerged. While top immunologists have suggested the booster dose for the ones with weaker immunity, government has said that they are still assessing the need for the 3rd dose. Here's more on that.
whether we call it a booster or a third dose or a fourth dose. It's very clear that we need to monitor the immune systems of immunocompromised individuals very, very carefully and make sure that they have some level of response to vaccine. We do need specific vaccination strategies, specific management strategies for them, and so far we have not had that.
There is a need and the time is now. That is the word from India's top vaccinologists, doctors, health experts on the third dose or the additional dose for those with poor immunity. At a time when the world has been confronted with the fifth variant of concern, Omicron, there is a growing demand for boosters in India, hoping it would offer further protection to those with compromised immunity. The government has so far said they're studying the need for the additional dose.
We'll continue to explore the timing and the need for the boosters going along. There are studies that are in the offing. There are studies that are ongoing, in fact, and there is data that's very systematically being tracked.
But the world is in a fix, say experts, and we can't wait, as vaccine hesitancy and complacency are also settling in.
There has been a vaccine hesitancy growing over past 1 month. And rather than having at least 1 crore vaccination per day, we are having 50-60 lakh per day. So we need to escalate vaccination. Number 2, we do not know whether this vaccine will protect this variant or not. And therefore, we need to have newer research and see that this variant is also covered in the vaccination program.
Urgent need of a third dose, which is now being called as a booster dose, but should be a part of the primary immunization. I think the boosters are extremely important in India. We should have a plan, but the fact is we need to be extremely wary and careful with regards to new mutants.
The focus, however, of the government is on the second dose coverage. The Prime Minister on Saturday took a review meeting in which he took stock of the slow pace of the second dose coverage in India that stands at around 45%.
The National Technical Advisory Group on Immunization is all set to meet towards the end of this month to discuss the need for booster doses for the immunocompromised population in India. A decision is obviously going to be depending on the kind of threat India perceives vis-a-vis the fifth variant of concern. A lot is going to depend on how India is analyzing the situation to protect its immunocompromised population in the light of the World Health Organization identifying the fifth variant of concern. In New Delhi, Sneha Mordani for India Today.